Hello, Dr. MINI.PG, Specialist Gynecologist, RUKN Medical Center, Ajman. Today we can discuss about breech position. Usually the babies will lie in the uterus with head down position, and delivery also first delivers head and then after body. That is called cephalic presentation. If baby occupies inside the womb in bottom down position, that is called breech position. Breech means that buttock is facing down. It may be sometimes the legs everything in folded position, but sometimes the legs will be extended. That position will be frank breech. Or sometimes the leg will be coming, first leg will be down more than bottom. That is called footling presentation. So why this breech position happens? This happens sometimes baby get space by occupying the breech position, that is bottom down. Sometimes placenta will be down, short cord, some tumor like fibroid or something occupying that lower part of uterus, or some septum, or change in shape of the uterus, or sometimes the baby's head will be large due to hydrocephalus, or some baby's problems like neuromuscular problems, or vertebral column problems. All these can cause a breech position. 3% of the babies will be in breech position. Initial scanning around 20 weeks, 28 weeks scanning shows breech position. Don't worry about that. That baby can turn automatically. After 37 weeks, if baby is still in this position, it causes little concern. Still baby can turn at the time of labor pains. Also baby can turn. Normally can turn. So if it is occupying the same position towards the term, we should think of that delivery may be little problematic. So we can try for external cephalic version, that we can change the position of the baby by flipping the baby and turning the baby. That all cases we can't do that. For that baby weight should be accurate, then baby water should be normal, no previous scar for the uterus, and no contracted pelvis, no placenta previa. If all these situations is there, we can do the external cephalic version. That is done in the hospital with the ultrasound guided in the labor room itself. If external cephalic version is not successful, then the other option is breech delivery can be allowed, but that depends on so many criteria. Breech delivery is little riskier than the normal delivery. Baby should be with a good, adequate weight, that is 2.5 to 3.5, not more than 3.5, not less than 2.5. Liquor should be, that baby water should be adequate. It's a term baby, no preterm or past date also not allowed for breech delivery. Then no placenta previa, no contracted pelvis, no previous cesarean or any operation scars on the uterus, no septum or uterine anomalies, no fibroid. In that case only allow for vaginal delivery. Usually first pregnancy, first delivery, breech is not allowed. So breech delivery has its own complications. In a second or third deliveries, provided the first one is a normal term delivery, then second we can think of the normal breech delivery for second or third time. Then breech delivery complications are more. That baby we should have a regular contractions, and that breech will descend and delivering the baby. The complications of breech delivery are cord prolapse, cord entanglement, cord stretching, and fetal distress can happen because the breech will deliver. Sometimes the head will entrap inside and it will not come. That can cause fetal distress. Fetal death also can happen. Then injuries to the bones can happen. So breech delivery should be conducted by an experienced gynecologist in a full setup with the pediatrician also should be there. So other cases in breech presentation, delivery will be by cesarean section.